Q in it. This is Rhea Hernia together with
Dr. Men.
Dr. Men. Today we shall be telling you about actually the books you need in clinical years, actually
Yes.
specifically for third year. I think we should start with internal medicine. How do you say it?
Yeah, it is okay for internal medicine. There are standard books that you need. Your book number 1.
Before you give us books, actually, how do they study?
So in internal medicine, studying is, should I call them presentations?
Yeah.
So they are going to give a list of names and then the topics that each of you is going to present. And remember, these presentations are awarded marks out of 10. So you organize slides, you present, and then you're awarded marks by your tutor.
So whenever you go early in the morning to which is internal medicine, what do they do? That if you can summarize for us one day.
Okay, on a typical day when you go to Chirudu, what you're going to do, depending on it, I'm going to use an example, Professor Kajimu's word, what they expect you when you
By that was on that word.
Yes, I don't know, you know better. Some of us who were in other words,
They would chase you.
You know, we would just go and beat snakes around. But so you are supposed to go very early, clerk every patient on that particular ward. Take all the vitals of each patient. Know every detail about each patient. So if you are 10, how many people? Like 5. If you are 5 and there are 30 patients, make sure you divide those patients among yourself.
I think one day you come and tell them actually what is clerking, because I understand clerking may be a new word. Some people, not all of them, but some.
Yeah, so we shall tell them what is clerking and how do you clerk in internal medicine, in obstetrics and gynecology, in pediatrics, and each of those have some technicalities for each. You will see when you're moving from one to another.
Okay, now books. Tell us about books.
So the books, the first book is Hutchison.
The famous
Hutchison. And in that Hutchison, if you're on Professor Kajimu's word, you must know the prayer at the beginning of,
which is the first page of the thing.
Yes, which is the first page of the book. So know it. Then read the examination system by system. Look for differentials of whatever you are saying. What are differentials for finger cladding? What are differentials for this?
I think they should also know that there are editions, so they mark specifically. We read up-to-date edition.
Up-to-date edition. So make sure you look for the
because I may tell that actually today's like edition is this, yet you are going to watch like a video maybe 5 years from here, which you have another edition. So by that time find the edition of that.
Yeah. So secondly, you need Davidson's. Okay, which is also famous, Davidson. But for clinical methods, other people may prefer MacLeod. There's also another book called MacLeod. But they will all professors, you'll see, lecturers will be referring to Hutchison's clinical methods and Davidson.
There's also Hudson actually.
There's also Harrison. There's also Clark and Kumar that I like.
So but actually at least get to one book and specialize in that. Be specialized in that book.
Yeah. So those are books for internal medicine.
Internal medicine. Now go pediatrics.
So in pediatrics, what do you do still on pediatrics? Pediatrics, they are going to put you in farms. Okay, so you'll be moving from one farm to another. So which books do you need? You need Nelson is number 1. Nelson's pediatrics. Then you need Uganda pediatric protocol.
Current edition.
Then you need
there is
who care for children, something like that. So
I think that there is a book which is in PDF. Also, there's an app.
Yeah.
So at least get two of them.
Yeah. And for pediatrics, when you read your protocol very well, and then you read that who care, signs and symptoms, you don't need to read so much of them. So
you talked about farms. Of course, you come and tell them what are farms. People may think farm is the farm of A. It is actually a farm of I. And then remember, there is Mwanamujim app. When you Mwanamujim, I think that's also another farm. We rotate there. But I think there are some books we read from there. Which books do we use when we're in Mwanamujim?
So for Mwanamujim, there is what they call Imam guidelines, integrated management of acute malnutrition, which you use, and then you can use other sources. But that's the major thing. Yeah,
actually there's another book which they say there are small books there.
Yes.
They can also help you.
Yeah, so that is for pediatrics. And pediatrics, the way they teach, they also divide. They call them expert sessions. So you are an expert. You're given a topic in a group. you prepare and present, and you're also awarded marks.
Yeah, I think forms of assessment we shall make another video for you,
forms of
because there
assessment,
are own cases,
clinical, yeah.
mini case, then there is OSCEs.
Yes.
Yeah, there are a lot of them, but we shall come and talk about them later. And I think you in the comment below, tell us actually which books you like and which books do you think is most important, and I have forgotten it.
And what do you want us to talk about next?
Yeah. So we got OBGY, that's obstetric gynecology in Kawempe.
Obstetrics and gynecology in Kawempe. Which books do you need?
Yeah.
The first book you need is Obstetrics and Gynecology by 10 teachers.
10 teachers.
That's what most people will be referring to. Have you read 10 teachers? Then 2, there's Williams.
Obstetrics and Williams, gynecology. Actually,
Yes.
those are different books.
Yeah.
10 teachers, gynecology,
and
10
then 10
teachers,
teachers
obstetrics.
obstetrics. So
Williams, gynecology, Williams,
obstetrics.
obstetrics.
So those are the books you'll need. But there are also guidelines, Uganda clinical guidelines on maternal and child health. Yeah, it is very important for you. So you will
which I think is called EMNC.
Yeah, EMNC.
I think the current edition was of recent, but it depends by that time which is the recent one of yours.
Yeah.
And I think me personally I use the Williams, because Williams is elaborate, it gives you, after those people who are reading Guyton in year 1, they find actually Williams enjoyable.
Okay.
Rather than the 10 teachers, people who are reading Seblinga can read what?
10 teachers.
teachers.
However, there are us who read funny books that I don't even want to mention here.
Of course, they will chase you away.
Yes,
Tell us about surgery.
So in surgery, there are diverse books that you can read, but the first one that most people read is SRB Manual of Surgery. So in there, it has very nice illustrations, very nice pictures that you will find even in your essential surgical skills exam. Then other people read Oxford Handbook of Surgery, very important. But among all those, there's Oxford Handbook of Internal Medicine, Oxford Handbook of Pediatrics, all those are there. What else do they need in
actually,
surgery?
most of surgery you run from what?
Yeah, but most of the surgery,
because it's hands-on at least.
is from what?
Yeah.
Hands-on, yeah.
I think those are the books we can. Is there anything? Because I think we started focusing on 4 principles or 4 disciplines.
Yeah, there are 4 disciplines which are further divided into clinical methods, then maybe theory.
Yeah.
Okay, yeah. So like in obstetrics and gynecology, you have 3 papers.
I think we shall come back and
We shall
hear
come
about
back
that.
and
But for
break
today, I
those.
think that is.
Yeah, that
remember
is
to
it for the
subscribe,
books.
Remember to
Remember,
like,
subscribe
and then tell
and
them
like.
about your what?
Yeah, higher education consult. We do training for mature age entry exams, diploma entry exams. We have materials, so contact us and then you excel. It's never too late to learn.
I'm Hernia Attire.
And Dr. Men here.
A finalist, Marquette University
Marquette
as of
University.
2022.